Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning in to my latest video. I had a client who attended with some lateral soft sticky wax in the left ear, which is the ear that we're performing the procedure on at the moment. There was a gap at the top, so I gently inserted the Jobson horn over the top of the wax near the roof of the ear canal and then behind, and gently just extract this lump of sticky fudge type of wax out of the ear canal. So this ear was pretty straightforward. It's the right ear, the ear that we're going to be showing you in a moment, which is a bit more complex, and the patient had a completely occluding ear canal with dead, damp skin and a bit of earwax. Just a bit of background, the patient advised that the build-up has gradually been getting worse for the last few months, but because of COVID, they were worried of seeking treatment sooner. And the other day, they accidentally got water into the ear whilst bathing, which exacerbated their symptoms. So water is the arch enemy of the ear. It's almost like the kryptonite of the ear canal. So it's well worth to avoid water at all costs entering your ears. And that's for everyone. I don't particularly have any problems with my ears, but I do avoid water entering my ears. And what I mean by that is, well, before I explain that, this is the patient's left eardrum, nice and healthy, fully intact. Is don't purposely, when you're showering, don't dip your head under the water, don't get the shower head into your ear canal. If you're washing your face and splashing a bit of water on your face and you get a couple of drops, that should be fine, but just don't purposely get water in your ears. So this is the patient's right ear, and you can see there's a lot of dead keratin, more so than earwax, and this keratin is adhered to the ear canal wall, so we're probably midpoint of the ear canal at the moment. As well as the water entering the patient's ear whilst bathing, they had been using some earwax drops, so they're a bit more medial now. And we just have to be careful because we don't know where the eardrum is. The average ear canal is obviously between 26 and 30 millimeters in length, but there is individual differences. So the further in we go in the ear, we just have to go in with a bit of caution, trepidation, because we don't want to be making direct contact with the eardrum with the long suction probes. It will be a bit uncomfortable, but I know we're roughly near around the eardrum at the moment because I can see the isthmus. The isthmus is a narrowing of the ear canal. So just where the suction probe is now, if you stick on the right hand side, you see the edge of the ear canal, and then it protrudes back outwards, and that's where we get the anterior recess. So I know we're on the eardrum now. I can just see a tinge of blue behind some of the dead skin that's still coating the ear canal. And I'm just going to attach a fine end gauge now. So whenever we work near the eardrum, I always attach a fine end. You can see we've got a lovely view of the tympanic membrane, so just some dead skin wax removed from the anterior recess. So the anterior means the front part of the ear canal, so to the right in the case of the right ear. And a fine end, it reduces the suction noise. So microsuction can be very noisy. When I've had it performed in my ear, I don't have wax, but when we do our clear wax training courses, sometimes I volunteer in my ear, and under the supervision of my colleague, I sometimes allow people in my ear, just not too deep, more mid-canal. And it does actually make my ears water. I get a reflex reaction there. I get a bit of kind of dryness in my throat and a bit of, my eyes water a bit. And so people do react differently to the microsuction procedure, but it is quite noisy. That's one thing to bear in mind. And a fine end, when we go near the eardrum, it's less traumatic. So if you do make contact with the eardrum, which sometimes we have to peel some of this wax, dead skin off, it's less likely to cause trauma. It allows me to do more precision work. So I'm able to gain access to all parts of the eardrum, the majority. And we're just on the posterior canal wall, so we're not on the eardrum there, we're near the eardrum, we're just on the bone. So the posterior canal wall, anterior canal wall near the eardrum, it's just a thin layer of skin attached to bone. It's very sensitive, so we've really got deep in the ear here with the endoscope. Got a lovely view. We're just removing some wax from the superior, so the top part of the eardrum, anterior, so to the right quadrant, so we can classify that as northeast if we're using a compass. And I've just bent the tip of the fine end, the distal end. So when we say distal end, we mean the tip the furthest away from us, the bit that it's actually doing the vacuuming. So again, I'm just going to the back part of the eardrum. This is the posterior part. So we can see the majority of the eardrum now. We can see the bluey tinge. There's a slight light reflex there. You can see there's a lot of hair in the ear as well. So you can see that hair has somehow got loose and it's stuck to the eardrum. We're not going to remove every single last piece of dead skin off the eardrum. It's just not possible. So again, I'm just trying to get some from in the anterior recess. You can see the bend there on the fine end to gain access. And the eardrum itself has become wrinkly due to the osmotic effect. So do a combination of using excessive drops, getting water into the ear. The eardrum itself is made up of 3 membranes. The outer lateral layer, so the layer that's prominent to us, visible to us, that is the same layer of skin that lines the inner 2/3 of the ear canal. And that skin's around 0.01 millimeters in thickness. It's very, very delicate. And that skin, it extends all the way the inner 2/3 of the ear canal, and it forms the most lateral outer layer of the eardrum membrane. The middle membrane of the eardrum is more of a fibrous, muscular, connective tissue, and the inner layer of the eardrum, which is in the middle ear, is the same as the middle ear mucosa. So that skin is full of blood. It supplies the blood to the eardrum and the middle ear. So really pleased with that. Patient symptoms were alleviated. That's that fudge type of wax from the first ear, the left ear. I hope you enjoyed that video, guys, and you're all keeping well and safe, and stay tuned, and I will upload some more videos during the course of the week. Thank you, bye.